So it's been about a year since the country was shut down for the first time because of COVID-19. And I've heard from some of my constituents saying, why are you so critical of the government? So I thought I'd look back on some of the disastrous policy decisions and some of the really important flip flops the government has made throughout this pandemic. So let's watch this with me.
One of the interesting elements of the coronavirus outbreak has been the spread of misinformation and fear across Canadian society that was actually noted by an interviewer on the weekend. In fact, she asked me, how can Canadians be assured that they're getting the right information? And I think one way might be that the opposition doesn't sensationalize the risk to Canadians and allows Canadians to understand where they can find effective information.
People sometimes drive fear because they like to. Sometimes they drive fear because it might result in a profit. You can sell more masks, for example, if you create more fear.
So this was in January and February of 2020, and we are raising points about the pandemic that is going on in China and how we have to take steps to stop it from spreading and coming to Canada. And these are the kind of responses that we were getting from the Liberals, basically saying we're trying to scare Canadians and being irresponsible. And it's a pattern that you will see throughout the last year.
In the beginnings, there was discussion of whether or not we should entirely close our borders to China the way the United States did. We did not, and we were able to manage it in a way that allowed for control and a non-spread of the virus that gives us confidence that our public health officials are giving us the right recommendations for Canada.
After the government received intelligence from our military about the dangers of the coronavirus in China, it allowed 2,000 people from the Hubei province, the most affected province, to come into Canada.
The long-term implications of shutting down borders is one, they're not very effective in controlling disease, as in fact, they're not effective at all.
So back when it would have really made a difference, we were calling for border closures, especially from places like the origin of the virus. And these are the kinds of responses that we were getting from Justin Trudeau and the government. Well, y'all, you know now that we actually have border closures. And in fact, in the House of Commons today, I asked a question about quarantine hotels and was told we have the toughest border control measures in the world. So we went from don't close borders, they don't work, when they actually would have worked, to borders now being closed when the virus is already here.
With our plan to mobilize industry, we're helping companies retool, repurpose, and innovate to fight COVID-19. We've already signed letters of intent with a number of partners to produce up to 30,000 made-in-Canada ventilators.
So it was reported that these ventilators that went to a Liberal insider, a new report now alleges that the ventilators themselves don't actually even meet standards. And what I can say is this, I know of a company in Dufferin-Caledon that couldn't even get their phone calls returned by the government about a low-cost ventilator that they had patented and were ready to produce. It's really, really not the way things should have been done.
Why did the opposition to play partisan politics in an unacceptable way instead of working with us? It's holding its hand out. It's still holding its hand. Our hand is still held out. Let's work together instead of partisan politics.
I want to review this failure and come up with a better path forward. We need to do that. That should be a nonpartisan issue. But the Liberals are blocking the Health Committee. They're blocking everybody from being able to do this.
You know, we'd love to learn about the attached documents in it, but unfortunately, in what is to become a trend throughout this package, it's all the relevant information in the two documents are completely blacked out.
Today, I have asked the Governor-General to prorogue Parliament.
So when we ask tough questions, or demand the government to do something, or try and hold them to account, or debate legislation, we're being accused of playing politics. They do that continuously. And then, when we do find something that's gone wrong, like the We Charity scandal, they roadblock us. They black out documents. And then, when it got too tough, they cancelled Parliament. That's what prorogue means. It's a fancy word for shutting down Parliament so you avoid tough questions, and that's what they ultimately did this past summer. It's really, really unacceptable.
Mr. Speaker, the United States has been approving rapid testing for months. The European Union has been approving them since spring. Our European trade agreement actually requires us to deem the processes for medical investigation to be equivalent to the EU. But Germany, Italy, and the UK have been having tests for months while Canadians wait hours in line. When are Canadians finally going to receive rapid testing?
This morning, I also want to talk about where we are with testing. Rapid testing is key to keeping this virus under control, especially in schools, long-term care homes, and workplaces. Last Friday, this is something I spoke about with Dr. Janine McCready in Toronto. We all want to see cases go down. We know that these tests can make a difference.
Other countries had rapid tests as early as the summer of 2020. And we would have been asking questions of the government about rapid tests, but Parliament had been prorogued or shut down. When we did raise the issue in September and October, we got no answers. And then suddenly, in February, 7 to 8 months after other countries had implemented rapid testing, the Prime Minister starts talking about implementing rapid testing. It's a massive failure that has had devastating consequences on the airline industry and the travel industry.
I think one of the things to remember is Canada no longer has any domestic production capacity for vaccines. We used to have it decades ago, but we no longer have it.
Evidence is continuing to emerge that Ottawa repeatedly turned down domestic offers for vaccine production. Nuvax approached the federal government in mid-2020, promising that they could be cranking 1 million doses out of their Montreal facility by December. The feds ignored them and decided to instead center all of Canada's vaccine production at an under-construction government facility that won't be completed until next year.
So the Prime Minister was not even honest with Canadians about our ability to produce vaccines. And there are more companies than the one that was just referenced. They were ready, willing, and able to produce vaccines in this country. Instead, the government chose to put all their eggs in the vaccine basket from countries around the world, which is why we ended up so far behind other countries like the United States in acquiring vaccines so that we could get to the point where we can reopen our economy and relive our lives.
When a vaccine is ready, Canada will be too. Indeed, Canada is one of the countries around the world with the very best portfolio of potential vaccines.
What you'll hear is we have the largest suite of vaccines. Yes, they bought lots of them, but we get them all later than other countries, which is why we're so far behind other countries in vaccination rates, especially the United States. They have vaccinated over 100 million people already, and they will have everyone vaccinated over the next couple of months. Our target is September. We are way behind, and it's because the government made critical mistakes in acquiring vaccines.
Understand that people are frustrated and they're at home and they're not doing things that they normally do and they're not seeing their loved ones. But now is the time to double down, actually.
And this is the kind of hypocrisy we get. Stay home, and yet the health minister is taking private jets back and forth from her riding. And of course, we saw many Liberal MPs who also traveled over the course of the pandemic. It's just not acceptable.
Small businesses. Your business has helped raise your family, created good middle-class jobs, and shaped your community. And your success will be key to getting millions of hardworking Canadians back to work right across our country. So I want you to know that we will always be there to support you, your businesses, and your workers.
The challenge has been there hasn't been enough support for businesses, especially small businesses. Through extended lockdowns, we have lost so many small businesses. And the fastest way that we could have reopened was to have had vaccines here sooner. And so by the government failing on vaccines, failing on closing borders early, we have ended up where we have lost so many great small businesses. And we all know so many in Dufferin-Caledon that have closed because of the pandemic.
If you're receiving both OAS and GIS, you will get an additional $500 in total to help you. And today, I can confirm that you'll be getting that money the week of July 6th.
So what you got for seniors was one small payment to help you through the pandemic, when so many other parts of society got so much more money. And just recently, in fact, last week, we voted on a motion calling on the government to increase OAS by $100 a month. Guess who voted against it? Justin Trudeau and his Liberal government. They did not want to give that kind of an increase to seniors who actually deserve it.
The Canada Emergency Response Benefit was put in place in a way that we knew would maximize the speed with which it would reach the millions of Canadians that needed it. That's why we didn't put a tremendous amount of complicated checks and background checks and verifications up front.
And so a lot of people now are having to pay back the payments that they received, and they don't necessarily have the money to pay it back.
That there was confusion because of what was written in the Service Canada website. In fact, I went to Services Canada. Take a look what is on the website still. Third bullet point there. No distinction here when it comes to gross income, net income. Is it fair to then go back to Canadians, say, you know what, the thousands of dollars that helped you survive through 2020, we want that back before the end of the year?
Yeah, no, I don't think it's fair. I think the CRA should have made it very clear.
How many emergency response benefit checks have been sent to people whose applications have been flagged as fraudulent? The department is reported to have given out 200,000. So is the number 200,000 the correct number of checks that have been sent out to people whose applications have been red flagged as fraudulent? CBC is saying that prisoners are receiving the check. They can't have lost their job. They were already in prison. Simple question. How many prisoners have received the checks?
You know, it was great that CERB rolled out quickly and so many Canadians were able to access it to supplement their income during lockdowns. But the alternate problem was it was so rushed and so quickly, and we were told we were playing partisan politics if we wanted to study it and make sure they got the legislation right. We had all of these problems. We had problems with confusion. People applying for CERB and then being told they weren't eligible and have to pay it back. Or, as we just heard, people who are ineligible were able to get CERB, which has cost the government, we don't even know how much money because they won't tell us. It's just really bad mismanagement of a program that should have run very smoothly.
I don't want you to have to worry about what you may owe in taxes. That's why we're providing 1 year without interest on certain 2020 tax debt, giving people more flexibility to repay amounts owing from last year. If you received federal emergency benefits, like the CERB, and you made up to $75,000 in taxable income, you will not have to pay interest on 2020 tax debt until April of next year.
So because they did not explain how CERB works to Canadians, there are a lot of Canadians who access CERB and now have taxes to pay when they've maybe lost their job and don't have the money to pay CERB. So in the end, we had so many opportunities to handle the pandemic better than we did. Countries like Australia, New Zealand, Taiwan, South Korea, so many others handled this so much better. Early border closures, quick rapid testing, they were able to contain the spread, and they're actually back to having normal lives and normal economy. What we have here in Canada, a massive debt, somewhere in the range of 1.3 trillion. We've almost tripled the national debt. We have the highest unemployment in the G7, and we're still not out of the woods because we're way behind all other G7 countries on vaccinations. If I were to give this government a report on handling of the pandemic, I would give it a D-. The one great bright spot throughout this pandemic have been people, and people in Dufferin-Caledon who have really risen up to help those in need. And we can certainly talk about all of our frontline workers, all of our doctors and nurses, our local businesses that donated meals to the needy, donated PPE to hospitals. There have been so many amazing people and companies that have done so much for us, and that is something that I hope none of us forget when we're finally out of the COVID-19 pandemic.